Good morning.
I was just counting with the meeting how many people were there.
Yes. Good morning. We'll begin with the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Good morning. Welcome to the Thursday, September 27th meeting for the Shawnee County Board of Commissioners. My name is Kevin Cook. I serve as the chair of the Shawnee County Commission. Joining me today is Commissioner Shelley Bueller. Good morning.
Good morning.
Commissioner Bob Archer. Good morning.
Good morning.
Madam Clerk, if we could begin with our first item.
First item is item 3, consent agenda.
Commissioners, there are 5 items on the consent agenda. Are there any questions?
I'll move to approve as provided.
Second.
Motion made to approve by Commissioner Archer, second by Commissioner Bueller. All in favor say aye. All opposed, passes 3-0. Our next item.
Item 4, new business. A, County Clerk number 1, consider all voucher payments.
We have vouchers totaling $1,380,380.76. Most of that amount is sales tax and JADO, $664,731.43. Past that, we have a special under Public Works, several projects under, let me see here, one for Southwest 29th Street, one for Northwest Button Road, and one for Southeast California. And those are totaling $130,136.94. I have no questions. If there are none from you, I will move approval.
Motion to approve by Commissioner Bueller.
Second.
Second by Commissioner Archer. All in favor say aye. All opposed, passes 3-0. Our next item.
Item A2, consider correction orders.
I'll move for approval of the correction orders.
Second.
Motion to approve correction orders by Commissioner Cook, second by Commissioner Bueller. All in favor say aye. All opposed, passes 3-0. Our next item.
Item B, Health Department number 1, consider approval of request to set the salary, including benefits, at $99,502 for the Health Protection Manager.
Good morning, Commissioners. Linda Oaks from the Health Department. So I just wanted to review really quickly some of the organizational changes we made that brought us to this position. So you might remember we did have 5 division managers. That's this over here, and I know it's small, but I just want to really emphasize the number of areas. So we had 5. We had a division manager retire, and at that time we felt we could condense the leadership team and go to 4. So the area that we were lacking some expertise in, however, is environmental health, which is health protection. I have worked in almost every department of the health department except that one. And so I really felt the need to have someone with the right expertise. There's a lot of regulation that goes into that. They work with the septic installers and repair, do the child care licensing. So I felt it was very important to have someone still overseeing that program, but maybe not at the division manager level. So we created this position, and you did approve it, the health protection manager. The staff person that I have in this position has 31 years experience in environmental health. I'm confident in his abilities, excuse me, to help us when we do have questions and issues. He's also very good working with the public. We do a lot of nuisance complaints, and those are tough. It's tough to get people to want to clean up their areas, and it's expensive and hard. And so I have watched him work with people. I watched him in court. You actually get some court orders for that. He's very good, very knowledgeable. And so he's got a few years left, and so we want to get all we can until he does retire and get that knowledge. And so this gives our division manager, Carrie Delfs, some time to learn that area. So because of his time with the department and his expertise, I would like him to start at step 18. It gives him a little room there, and we will use and abuse him as long as we can to make sure this area is covered and we have the necessary expertise. So I'd be happy to answer any questions about this. I do, and one more thing I do want to say. With the elimination of the division manager and the team leader, we did save $67,000. And when we did that, we did ask for another position, administrative assistant. So we're still ahead, almost $22,000 by this change. And we do have it budgeted in our 2018 and 2019 budgets. So I'd be happy to answer any questions.
First off, we do not use or abuse our employees.
It was a joke.
We take advantage of all opportunities and skills that they have.
Thank you. That's true, too.
But Linda, this does kind of make this a little bit leaner department, and so this is going to be more efficient for operations?
Yes.
And is this going to be, allow the public to have some better responses and more efficiencies when they are getting the septics and environmental issues taken care of?
I do believe it does, and I think that department has had great track record with that, and I think they will continue that service. We want to make sure we learn, the people that are coming up that are not retiring in a few years, they learn those systems and areas so we provide that good customer service.
Okay. One question that I do commonly get asked is this just a way to try and give somebody a raise without going through all of the other protocols? Absolutely
not. He had to apply for the job. He has got a lot more responsibility than he did before. He's got child care licensing now. He has to oversee. So, no, I feel like the money savings is worth it, and having less of an upper management and more in the trenches, people doing the work.
Other questions, Commissioners?
No.
Commissioner Archer?
Thank you.
Well, I just want to compliment you, Linda. You've done a tremendous job since taking over the health department. A focus on saving taxpayer dollars and customer service is excellent and fits in with what the commission really wants. So I'll move to approve the request.
Motion for approval by Commissioner Archer. Second by Commissioner Bueller. All in favor say aye. All opposed? Passes 3-0. Our next item.
Thank you, Commissioners.
Thank you.
Item B2, consider approval of request to fill a vacant registered nurse position in the Women, Infants, and Children Program at a salary including benefits of $66,156, and to fill any positions that become vacant as a result of filling this one.
Good morning, Commissioners. Carrie Delfs with the Health Department. This is a request for your approval to fill the registered nurse position. This position became open due to a retirement. This registered nurse would be responsible for providing nutrition education and counseling, referrals to other services like immunizations, dental care, housing, and they also certify eligibility of WIC participants. The position is funded entirely through the WIC grant and is included in the 2018 and 19 budget. I'd be happy to answer any questions.
Any questions regarding this position?
I'll move approval.
Motion for approval by Commissioner Bueller.
Second.
Second by Commissioner Archer. All in favor say aye. All opposed? Passes 3-0. Thank you
Thanks.
very much. Our next item.
Item B3, consider approval of request to fill a vacant master's social worker position at a salary including benefits of $58,742, and to fill any position that becomes vacant as a result of filling this one.
Good morning, Commissioners. Teresa Fisher with the Health Department. We had a recent resignation in our First Steps program, and this is a licensed master's level social worker, and so that request today is before you to ask to refill this. This position is funded through our Maternal and Child Health Block Grant that we receive from the state. It is included in our 2018 and 19 budgets. This particular position provides intensive home visitation to pregnant women and then families with young children, typically under the age of 1. We do some general case management, and these are typically some of our more at-risk clients here in our community. I'd be happy to answer any questions you might have.
Any questions?
Move to approve the request.
Second.
Motion for approval by Commissioner Archer. Second by Commissioner Bueller. All in favor say aye. All opposed? Passes 3-0. Thank you. Our next item.
Item B4, consider authorization and execution of contract C301-2018 with the Kansas Children's Service League, KCSL, for outreach, prevention, and early intervention services with funding from the Early Childhood Block Grant in a total amount of $895,000, $360,000 to KCSL, and $535,000 to the Health Department.
Good morning, Commissioners. Teresa Fisher with the Health Department. Before you is a request today to enter into a contract with Kansas Children's Service League. This is a new contract. We have had renewal contracts in the past, but there was a new contract that was rewritten this year. The two programs that provide this are the Nurse Family Partnership through the Health Department and then Healthy Families, which is through Kansas Children's Service League. The Early Childhood Block Grant provides the matching dollars that we use here in our community in order to receive the Medicaid match grant through Kansas Department of Health and Environment. And the reason that we contract with KCSL is the Medicaid match dollars are only accessible through a local health department, and they wish to enter into a contract to be able to access those dollars with us. I'd be happy to answer any questions you may have.
Any questions regarding this? Commissioner Archer?
You said that the contract was revised from the previous version. Could you give us some of the highlights of the changes?
Absolutely. There's a few new reporting forms, and then also we basically have, I want to use my exact words here to make sure that we are using that correctly. We are following that we are a subrecipient, or the Kansas Children's Service League is considered a subrecipient of this grant. And so that just adds a little bit more layers to what the health department needs as far as auditing mostly their financial side of things so that we're in compliance with the KDHE requirements.
So it's an improvement in the financial disclosure?
Yes.
Is that what you're saying?
I would say it's definitely an improvement so that we will have full disclosure. We now have things outlined from Kansas Department of Health and Environment as far as what we are expected to be monitoring. And so we can have full disclosure from both the health department side and the Kansas Children's Service League side.
Okay. Thank you. Thank you, Mr. Chair.
Any other questions?
No.
I'll move for approval.
Second.
Motion for approval by Commissioner Cook, second by Commissioner Bueller. All in favor, say aye. All opposed, passes 3-0. Our next item.
Item B5, consider authorization and execution of contract C300-2018, Memorandum of Understanding with United Way to provide $266,397 for the Nurse Family Partnership Program with a 10% match from the tax allocation.
Okay. Good morning, Commissioners. Teresa Fisher with the Health Department. This request before you today is to enter into a contract with United Way. They wish to serve as the fiscal agent for the Early Childhood Block Grant, of which the Health Department is one of the recipients here in our community. They have served as the fiscal agent for this grant over the past few years. And again, the Early Childhood Block Grant funds serve as match dollars for our Medicaid match dollars that we receive through the Kansas Department of Health and Environment. I would be happy to answer any questions you may have.
As a fiscal agent, what are their responsibilities?
They are required to compile all of the monthly financials. There are 8 different recipients in our community, so we provide all of our monthly financials to them, and they compile them, and then they send in the affidavits to the Children's Cabinet on, I believe, a quarterly basis.
Any other questions? No. I'll move then approval.
Second.
Motion for approval by Commissioner Cook, second by Commissioner Bueller. All in favor, say aye. All opposed, passes 3-0. Thank you very much. Our next item.
Item C, corrections. Number 1, consider authorization and execution of contract C302-2018 with Aramark, incorporating an adjustment to the per meal cost grid in line with the projected consumer price index for the products purchased to provide inmate meals, incorporating a 2.5% increase in price per meal.
Good morning, Commissioners. Tim Phelps, Department of Corrections. This agreement is the final under the current contract with Aramark before we issue an RFP to see if there's another vendor that can offer us better services. So we're finishing this up with a CPI-based increase to cover through the end of September of 2019. I'll be happy to answer any questions you have.
Any questions regarding the contract? No.
I'll move to approve.
Second.
Motion to approve by Commissioner Archer, second by Commissioner Bueller. All in favor, say aye. All opposed, passes 3-0.
Thank you.
Our next item.
Item D, Information Technology. Number 1, consider authorization and execution of contracts C303-2018, C304-2018, and C305-2018 with Alexander Open Systems, now a Converge One company, for annual licensing and maintenance of 2 vBlock server visualization platforms at a total cost of $109,675.17 with funding from the IT 2018 budget.
Good morning, Commissioners. Pat O'Blander with the Information Technology Department. It doesn't seem like 5 years have gone by, but about 5 years ago we purchased 2 large platforms to serve as the infrastructure to support all of the critical servers for Shawnee County. During that 5-year interval, maintenance and licensing was all covered under the original contract. We're now at the end of that contract, and it's time to begin paying the annual maintenance out of the IT budget. We did prepare for this back in May of last year. We put in some room in the budget for that. We underestimated a little bit at that time what the amount would be because we had to go through and look at the original contract, and prices have changed over that 5-year interval. So we were a little short, but I do believe that we will be able to cover the overage with savings from other areas in the IT budget. So I believe we'll be able to cover this nicely in the 2018 and 2019 IT budgets. If you have any questions, I'd be happy to answer those.
Pat, 5 years ago when we started virtualization, you told us by going to virtualization on a platform, we would be saving the taxpayers money, that this would be an efficiency for your department by retiring the mainframe, which had been in existence for many years.
Decades. Literally.
Decades.
Yes.
And that it would add us a redundancy so that if there was anything to happen, our financial data would not be lost or compromised, that we wouldn't have a shutdown of the entire county. So what has been the impact of going to the virtualization platform?
The impact has been everything that we had hoped it would be. We found that the system has been extremely stable. I've got to be careful not to get too far into that because I'm going to tempt the fates, but I don't want to see any disruptions. But over the 5-year interval, we have had no outages of that system. We did have power failures that hit one of the platforms, but there was no disruption in service because we did have the redundancy in place. We have had hard drive failures in the platform, which is normal for spinning hard drives in systems of that size. Again, we were able to detect those and replace those with no disruptions in service. So the redundancy has paid off very well. The stability of the systems has proven itself over time. The ease of implementation of the system was everything that we had been told it would be. We were able to install it as a turnkey system with a lot less effort on our part to get it stood up and running. It's been relatively easy to maintain. It uses VMware as the hypervisor, which is a very common platform that a lot of people understand. So we're very comfortable supporting it, maintaining it. It has indeed answered all of those questions that we had at the beginning that we wanted answers to. So very pleased with the performance of the system.
I know that 5 years ago, Commissioner Archer asked, why aren't we putting this all on the cloud? And I know that you had some reservations at that point about security of the cloud, the capabilities. As we have seen the more cloud-based services and technology, where do you see our virtualized platform going in the future?
What I see, and I do remember the question at the beginning, and we at the time when we were purchasing the V-Block systems, we were not prepared to move the county fully into the cloud at that time due to security and performance reliability concerns. Those concerns have abated over the years. We are now more comfortable putting resources into the cloud and using those as the mission-critical location. We're not there 100% yet, but we are beginning to move some of the servers that we're using here in Shawnee County into the cloud, and I expect to increase that transition over time. As these systems age out, these V-Block systems, I do expect to get another at least 2 or 3 years of service out of those. But during that period of time, we will need to replace them with on-premises hardware platforms that will support what we have to keep locally. That amount will decrease over time, but for the immediate future, we will have to keep some of it here. But I do expect that the vast majority of our servers will be on the cloud here in the next couple of years.
By doing that, are we going to see further reduction in cost and equipment and?
Yes, we will see a reduction in the amount that we have to purchase for hardware up front and the annual maintenance costs for those. I also expect to see reductions in costs for the services that we'll be contracting from cloud service providers. That typically is a less expensive proposition, as long as they're able to answer our questions about security, reliability, and accessibility. And so far, the things that we've seen have looked really good. So I expect that that's where we'll be over the course of the next 5 years.
Congratulations, Commissioner Archer. You are ahead of the curve.
Well, I remember it was a rainy day 5 years ago when we discussed this. I'll make a motion to approve the contracts.
Second.
Motion to approve by Commissioner Archer, second by Commissioner Bueller. All in favor, say aye. All opposed? Passes 3-0. Thank you, guys.
Thank you, Commissioners.
Our next item.
Item E, Public Works Solid Waste. Number 1, consider approval of change order number 1 reflecting actual quantities resulting in a decrease of $3,408.62 for the Northwest Button Road over tributary to Half Day Creek Bridge project.
Good morning, Commissioners. Tom Flanagan, Public Works. This is the final change order, which accounts for our as-built versus as-bid quantities. It resulted in a minus $3,000+ decrease in the contract price. We came in under budget, and we were on time for completion of the project. Happy to answer any questions.
Any questions for Tom?
That's a hallmark of Public Works in Shawnee County.
Thank you.
Is there a motion?
I'll move to approve.
Motion to approve by Commissioner Bueller.
Second.
Second by Commissioner Archer. All in favor, say aye. All opposed? Passes 3-0.
Thank you.
Thank you. Our next item.
Item 5, Administrative Communications.
This is an opportunity for any department head or member of the public to address the commission on any item.
Good morning, Commissioners. Kellen, Site Inspector Venue Management at the Kansas Expo Center. Happy to announce that we did announce Harlem Globetrotters yesterday, coming back to the building in February. Pre-sale tickets for Harlem Globetrotters go on sale Wednesday of next week. That's going to be October the 3rd. And public on-sale tickets start on the 10th for that. So just a reminder, we have about 4 more announcements and on-sales, and likely another announcement in there somewhere, coming up over the next couple weeks. So stay tuned.
Sounds good. Thanks, Kellen. Our next item, or anybody else?
Good morning, Commission. Herman Jones, Shawnee County Sheriff. I am here to announce that we have a permanent emergency communication director. And I just want to introduce publicly who that person is. Been serving as an interim, and I just want to let you know some of the qualifications and her background, what goes with that. Now, Melanie Mills Burgers comes to us. She started as a communication worker or a communication specialist in 2004. Today is her 14th anniversary, as a matter of fact. And it's quite fitting that we bring her up to this point where she's worked her way through the system. She's been a communication specialist. She served that for 3 years, and after that, she became a trainer for a communication specialist. She served that for about 5 years, and then following that, she became a shift supervisor, and is served in that capacity for 4 years, and following that, she was the assistant director in the communications there for about a year, and then as of November the 17th, she has served as the interim emergency director, and it is at this point we appoint her permanently in that position there. Some of her qualifications that she comes as not only she's a member of APCO, but she has been a communication trainer that has also been served through the APCO institution there. She's a graduate of the the Emerging Leaders Academy, which is a CPM program out of KU. She is also a CPM manager, certified. She serves on the Kansas 911 Coordinating Council, representing the PSAPs, serving a population of 75,000 or greater. She was appointed by the governor in 2017 to that position. And just recently, she is a certified public safety executive from the APCO International. So she's very qualified. Now, in that interim that she served, it wasn't just a point of just sitting there and just letting things go on. She's been very progressive in our communication. I know that's been something very significant, on your mind, of those type of things, but she's been very significant in our hiring and recruiting. As you know, we've tried to expand that. We're always looking for those that are looking on TV. We're always looking for new ones. But she's had a very high focus on the hiring and the retention. And from that, she's had some significant programs where we're coming in to not only to attain, but also retain some of our employees there. She's been engineering some of the technology of the next gen 911. That is the system where now when individuals are calling, not just by phone calls, but cell phones and texting and all those types of information that we can come and gather when we can respond to those the public when they're calling for emergencies or so. She's implemented an academy for our new employees. Whereas in the past it was kind of an OJT, now we put them through a strategic plan where they actually go through an academy. It gives us more success, and by that we've been able to retain those new employees at a higher rate than what we have in the past. Along with that, she has enhanced the training, not only just the academy, but also those when they're on the floor going through the training itself. We've also partnered, as you know, with the Washburn Tech that gives an idea of what the training is all about and gives basically an overview of communication workers. And we've been successful for bringing new employees from that program as well. She's been very instrumental of the new phone recording logging system that we have. And also with the P25, as you know, we've gone through the process some years ago, but also the upgrades of what we've been dealing with there. One significance was taking the load off of our communication specialists when they're taking calls and for the radio, but also calls that are coming in. One significant change is that she's implemented is a call taker's position that we've called. And by doing that, we've taken basically the load off our communication specialists. About 45 to 50% of those calls that come in, they don't have to deal with, but the call takers take. So it makes a tremendous impact on what we're doing. Just kind of give you an idea, our dispatch or communication specialists, they average about 800 calls per day. Basically about 300,000 per year is what that comes out. But in that then, dispatchers over 180,000 calls for service per year, which is averaging about 490. So that's what each one deals with. And as we know, we're dealing with 5 different law enforcement agencies in this county, as well as 9 fire departments right there. So those are the qualifications. Want to make people aware of that right there. And I'm probably going to embarrass her and ask her to come up, step up, and just say a few words, if you will. So, Melanie?
Good morning, Commissioners. Sheriff, as he addressed, my name is Melanie Mills-Burgers. I appreciate the Sheriff giving me this opportunity. I think what sets me apart is that I have worked in every capacity in our communications center, skipping over the floor supervisor. And my passion for the people that are in there, we can implement new technology, which is coming. You know, we have a lot of work to do, and I think what we've done in the past couple years is nothing short of amazing. The team that we have in that communications center is really what makes it. It's not going to take one single person. We're very fortunate to be under the Sheriff's Office and have that excellent team of captains and support from the Sheriff and the administrative staff in our communications center. So I really look forward to continuing growing and focusing on hiring and retention. We have Next Gen coming towards the end of November. We've been working on that for quite some time. And as we implement new technology and new policies, things that really will make our center better, it won't be anything unless it's the people. The people in there are amazing. They work very hard. The overtime that we have is not going to go away tomorrow. It's not going to go away in the next 6 months. We have 7 people in the hiring process right now. We've worked on some initiatives with HR to get some different application processing and kind of streamline our recruiting efforts. So we're really looking forward to getting more people in there, and that's going to be the focus and holding on to those people. Any questions?
Well, I know that you've done a great job in addressing employment, working with HR, addressing the needs, changing the physical layout of the communication center, trying to address some of those physical attributes of how the communication center is set up. And, you know, we've seen a lot of great improvements to the communication center since you've come on board. Last Friday, I had the opportunity to speak to the Department of Corrections for an officer graduation. And as I commonly will say to the Academy, this is not the end, this is the beginning. We expect greater things from this point. And so this is not the end. Congratulations on reaching this point, but we expect in Shawnee County a lot more, and we know that you have those capabilities to do it. And so I look forward to seeing the continued improvement to communications from this promotion. So,
Thank you.
Commissioners, anything?
Congratulations.
Thank you.
I think it's a tribute that is very well deserved.
Thank you.
Thank you, Mr. Chair.
And I would just say, excellent decision, Sheriff, and congratulations, Melanie. I know you are doing an amazing job. I know you'll continue to do that.
Yes, ma'am, we will. Thank you, Commissioners. I appreciate it.
We look forward to continued improvements. Thank you.
Thank you, Commissioner. I also want to mention that all of our end users, all our partners there, think the world of her as well.
Thank you, Sheriff. Any other administrative communications this morning? Commissioner Bueller, anything?
No, I do not. I think you're going to hopefully cover the Parks and Rec.
I am.
Yeah, okay.
I am.
All right.
Commissioner Archer, anything?
Well, we've got I thought Linda would come and talk about the meeting we've got at 11:30.
Yes.
I wanted to make sure Eric showed up. I know Tim will be there. so-
Yes, today at 11:30 is the Community Health Needs Assessment Town Hall meeting. And so this is the final meeting. We will hear about the surveys. We will be doing some brainstorming about where our community needs to go next in improvement of health. I'm really excited about a great turnout today, and I hope everyone will come. And there's free lunch. Thank you, Stormont Vale. So they've been great partners through the whole process. So thank you.
Linda, I might just, if I could, just add, I mean, this is something that our community is getting into a pattern of doing
Yes.
every 3 years, correct?
Yes, this is our third.
Right.
Yes.
And so I think that's important. This is just not a one-shot
Right.
Yeah, good point.
occurrence, that we are getting into a pattern of reviewing what our needs are health-wise in our community. And we're addressing them with plans
We are.
to put in place to improve, so.
And we'll be writing a new community health improvement plan. The last one was in 2015, so this will be the next phase of this project. And there'll be probably more meetings and more input asked for.
That's
So,
good.
Thank you.
Great.
This is
Thank you.
great. I did have down at the town hall to talk, make sure we touched on that. This afternoon, again, this is not a county project, but does tie into the county. At the library from 4:30 to 6 p.m. is a discussion of the bikeways Phase 3. And as we talk about the bikeways does tie into community health. It also ties into our trails program and how we might coordinate that with Public Works and Parks and Recreation and Health Department. So it does overlap a lot with what the county does, even though it is the city's open house presentation of the 2019 Bikeways Phase 3 that is at the Shawnee County Public Library. This Saturday on the 29th at the Betty Phillips Park, there is a dedication of a mural for the basketball, and again, talking about community health and involvement. And so we'll be having an announcement of some improvements to the Betty Phillips Park at the basketball court there. I hope everybody has an opportunity. Downtown this weekend is the Chocolate Festival. And so make sure you get out and come downtown and support our local businesses. Next week, we do have the dedication of the Gage Park Fitness Loop. That is on October the 9th. So I guess it's just a weekend. But again, public health is involved in a lot of different aspects. And then finally, Shawnee County Parks and Rec did receive a national accreditation. And so we were notified that we have achieved the rank of being a nationally accredited Parks and Recreation. So this is a huge accomplishment for our department and a huge accomplishment for Shawnee County. So
Yes, it is.
It is.
lots of good things to talk about in our community. Madam Clerk, our next item.
Item 6, executive session.
There is a need for an executive session for personnel matters of non-elected personnel, specifically to discuss the Director of Public Works, and this would be for a period of 30 minutes, and no action anticipated, and that's a motion made. Is there a second?
Can we make it 20 minutes
Sure.
and then go from there? If
Sure. 20 minutes.
if that's okay.
I will amend. Is there a second?
Second.
Okay. Motion made for executive session for 20 minutes by Commissioner Cook, second by Commissioner Bueller. All in favor, say aye. All opposed? Passes 3-0. We are in executive session for a period of 20 minutes.
What's for lunch? Burger and
We're ready to go. We'll go.
We are back from executive session. No action taken. We are adjourned.